If you or someone you loved is pregnant, this video is for you. Just a few minutes of watching could help protect a life that hasn't even entered the world yet. So pause what you're doing, save this video, watch it carefully, and stay with me till the end. Because what you learn here could make the difference between danger and safety for your baby. Now, let's begin. Sign 1. Decreased fetal movement. Has your baby been unusually quiet today? One of the first and most urgent signs that a baby might be in trouble is less movement. Most moms begin to feel movement around 20 to 24 weeks, but after that point, especially in the third trimester, you should feel your baby moving every day. If you notice a sudden drop in activity or your baby isn't moving at least 10 times within 2 hours after a meal, this could mean the baby isn't getting enough oxygen or is in distress. Don't wait. Go to your doctor, get a non-stress test or ultrasound. Your baby might be silently asking for help. Sign 2. Persistent abdominal pain or cramping. Some discomfort is normal in pregnancy, but sharp cramping pain that doesn't go away. That's not something to ignore. Pain in the lower belly or lower back that comes in waves or becomes more intense over time could be a sign of miscarriage, if before 20 weeks, preterm labor, if before 37 weeks, or in some cases, a dangerous condition called placental abruption, where the placenta detaches early. If rest doesn't make it better and the pain keeps coming, go get checked right away. Sign 3. Any vaginal bleeding. No matter how far along you are, bleeding is never normal during pregnancy. A few pink drops, a brown discharge, bright red blood. All of these could be signs of implantation problems, threatened miscarriage, placenta previa, or placental abruption. It might be nothing serious, but it might be the only visible warning you get. Call your doctor, even if it's just a little. Don't wait for it to get worse. Sign 4. Fluid leakage before 37 weeks. Did you feel a trickle of fluid that didn't smell like urine and didn't stop? That could be amniotic fluid leaking, and it's a major red flag, especially before week 37. Your baby needs the amniotic sac to stay safe from infection. If that barrier breaks too early, it's called preterm premature rupture of membranes, or PPROM. This increases the risk of infection, preterm labor, and complications for the baby. If you're unsure, wear a pad, monitor it for 30 minutes, and if it continues, go to the hospital. Sign 5. Headache, vision changes, and swelling. Are you dealing with a persistent headache, blurry vision, or sudden swelling in your face, hands, or feet? These are classic signs of preeclampsia, a serious pregnancy complication that affects your blood pressure and organs. If untreated, it can lead to seizures, stroke, or harm to your baby. This usually shows up in the third trimester, and it's not always dramatic at first, but it can escalate fast. If you feel off, don't downplay it. Get your blood pressure checked and call your doctor immediately. Pregnancy is beautiful, but it's also full of signals your body is constantly sending. Some are normal, but some are silent alarms. These 5 signs are your baby's way of saying, please, get help now. Don't second-guess your instincts. If something feels wrong, it's always better to check, and if this video helped you, please like it, save it, and share it with someone who might need it, even if they don't realize it yet. Subscribe to our channel for weekly videos on safe pregnancy, women's health, and protecting your baby from day one. In our next video, how to recognize early signs of miscarriage and what you can do. Take care, and see you there.